Hello friends, today I'll show you my own EMR which I have been using in my hospital for last 6 years, and it was started in 1992 actually by my father Dr. Singh Dhaliwal in DBase, and slowly we have graduated to Microsoft Access now. The entire data of DBase was transferred to Access. The concept of this EMR is not to make you use my EMR actually. It's not about selling you my EMR. What the message that I want to give you is that innovate your own EMR according to the needs of your hospital. Do not be dependent on these companies which are selling you these EMRs for so much of money, your hard-earned money, and making you and your staff dependent on these companies. For even small and minor problems, you have to call them, and then their engineer will connect to you online, and then they will solve your problem slowly, and then you have to shell out more of your hard-earned money. And again, for each customization that you require in your hospital, each need that you want to add in your hospital, the EMR company charges you for that. So my concept is not to sell you my EMR. My concept is to make you aware of what all is already available in your laptop or your PC which has Microsoft Office, and you can just innovate your own thing, your own database, for the good of the patient. So let me show you my EMR. So actually it is a very simple thing which has three modules. One is reception, and we have two consultants working in our hospital, and for the two consultants. Now I have just opened the reception module. So now I want to add a patient to the first consultant, and that is the OPD one. So I have clicked on OPD one. It will open a database which looks very much exactly like an Excel sheet. So whatever need I have done it according to that. So rest of the columns I have hidden from this uh, Excel sheet. Now I'm entering the time at which the patient has reported to my clinic. Now I assign an EMR number or MRD number, whatever you like to call it. So this is the MRD number of the patient that has just entered my clinic. Enter the first name, last name, age, sex, phone number, and the place where that patient belongs to. So these are the basic requirements of my hospital. So I have designed it according to my clinic. Just close this module, and now I'll open the module of consultant 1. Okay. So it asks for password every time. It is password protected. Now I have opened the form for consultant 1. Now I have seen that patient. Now I want to write medicine. Now when I open this prescription, all the details including MRD number, name of the patient, age, sex, and place, the time which he had reported on, are already available. So I just type the diagnosis or secondary and my findings in the column of secondary diagnosis in the column, and we are ready to go. So I have this designed according to my needs. Whenever I type H10.0, it will automatically write mucopurulent conjunctivitis. Actually, it is a drop down menu in which I have already fed those diagnosis and their ICD-10 codings which are in my daily routine use. So this prescription, I have designed it in such a way that the medicine comes with the generic name and the dosage comes in Punjabi. The instructions to the patient also comes in Punjabi. I can give any kind of remarks that I want to give, and there is a hidden button on the top left side for the print record. So you can print the record, print this prescription for the patient Vikram Dhaliwal here, and you can go ahead to the next patient. Now to the same patient you want to give glasses number also. So I have just opened another form in which I'm typing the glasses number. You can notice now that the diagnosis, secondary diagnosis, and the drugs that we prescribe to the patient are already here. So this is just another format of the print that I want to give to the patient. There's a drop down menu for all kinds of glasses that I use in my routine OPD. So again, we can just print the record and give it to the patient. So this is the module for medicines as well as glasses prescription. The receipt of the patient is already ready. Some patients ask me for glasses prescription along with receipt for their company reimbursement purpose. That module is ready. If a patient asks me for a medical certificate, the medical certificate is already ready, because once when I have fed these things into the EMR, these are just the forms for the same thing. Okay, so these are the prescriptions. If I want to give a prescription in English, because now I had entered the name in Punjabi, so it is looking like haywire, but now I can change it to English also for the purpose of the benefit of the patient. So everything can be changed here. Now the instructions to the patients has also come in English. So this is how I see the patient save time and just give a printed thing to the patient. So this was just to give you a feel of my designed EMR, and the message was, again I would repeat, not to sell you this EMR. The message was just innovate your own EMR and do it yourself, and don't be dependent on these companies which charge you so much of your hard-earned money. So thank you very much.